Menopause Energized 30-Day Healthy Heart Marathon, Day 1.
Hey everyone, my name is Sheila. Welcome back to Menopause Energized. Today marks the exciting beginning of our 30-day marathon for heart health. And I'm so glad you're joining me on this journey. At the end of this 30-day marathon, you will gain valuable knowledge and practical tools and lasting strategies to improve your heart health and overall well-being during menopause. Now, ladies, I think we probably may already know this, but did you know that heart disease is the leading cause of death in women? This is an important issue that every woman needs to be aware of. Women often experience different symptoms from men. While men typically feel strong chest pain, or not even strong chest pain, but women can get a little different symptoms as well. They can have shortness of breath, and that may be the only symptom they have. But again, they can also have other symptoms with that. You know, they could have chest pain, nausea, unusual fatigue, or just feeling off. Women's symptoms are frequently misdiagnosed or dismissed as anxiety or digestive stress issues. We can have the lightheadedness, the jaw pain, the chest pain as well. Heart disease affects women at every age, though the increase after menopause goes up. The good news is that about 90% of heart disease can be prevented through lifestyle changes. Why is this topic so important to me? Because when I worked as a cardiac nurse at the bedside, my passion was to provide education and guidance to both men and women regarding maintaining a healthy heart through lifestyle choices, preventive care, and early detection. When I worked at the bedside, I worked with some of the best cardiologists, and I learned a lot. Now, the Menopause Energized program, which is my program, takes a holistic approach to women's health in the menopausal years. But ladies, for the next 30 days, we are going to just focus on the heart. So let's dive in and make every day of this marathon count. Today, we're going to discuss the anatomy of the heart. Understanding anatomy of your heart is the crucial first step in this 30-day menopause journey. When you know how your heart works, ladies, you gain a foundation to understand why certain conditions develop and why you might experience specific symptoms. This knowledge empowers you to make informed choices and take control of your heart health during your menopausal years, because you can't protect what you don't fully understand. Don't worry, this won't be another boring anatomy lecture. I will keep it fun, engaging, and easy to follow. You will walk away not just informed by our program, but you'll be inspired to take charge of your heart health. Each day, like I said, for 30 days, I will be bringing tips and strategies of how to protect your heart. Now, each day is not going to be like an hour long. I would not take up your time like that for 30 days. It'll be probably about 5, no more than 10 minutes each day of just giving you some tips and just educating you about the heart. So what we're going to do today, you see this heart in front of me? The foundation for the day was they tell you, you can't go through anything else. You have to build the foundation first, and everything takes off from there. So we are going to only talk today about how the heart works. And I'm not even going to get into all the complex details that I could go on and on. Because like I said, this is my passion. I'm going to try to do the simple things. If you have a notepad there, get your notepad and your pencil so you can take down some notes. There are some things you don't have to write down. I don't want you to get all ruffled trying to remember all this stuff. Sometimes I will give you this signal letting you know that those are the things you should really concentrate on and remember. So let's start with the diagram of the heart, and I'll let you know how everything, not everything, but some things work with the heart. So the first thing is that, and by the way, I'm also going to be using my 3D model as well, if you can see that, so that can explain it a little further as well. So the first thing we're going to do, I'm just going to go briefly through how the blood flows through the heart. Okay, this is one thing I want you to know. We have 4 chambers of the heart. we have the right side of the heart and the left side of the heart. 4 chambers. For the right side, 2 chambers. We have the right atrium. You probably can't see these words too well, but if you zoom in, you'll be able to see it. But this is the right atrium. And then we also have, let's see, we're going to go down to the right ventricle. So this is the right side of your heart. Those are 2 chambers. The other 2 chambers, hop over here to the left side of your heart. And you have the left atrium and the left ventricle. So that's what I want you to remember. You know, we have the 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Now, our body has blood that flows through the system. Our organs need that blood flow and oxygen for the organs to survive. If we don't have that, the organs die. So there are a lot of complications that happen in life that where the organs do not get that oxygen and the organs die. And we'll get into that in just a few minutes. I just want to show you the blood flow. Now, the blood flow, once the blood is carried out into the body, it's carrying oxygen-rich blood, just to let you know, and we'll show you how that all works. But when it comes back, boy, those organs wore that blood supply out. They need to get refueled. Just like when you run out of gas in your car, you got to get to the gas station to get more gas. That's what's happening to your body. Once it disperses through your body and gives the blood flow to your kidneys and your liver and your extremities, there's nothing left hardly. They got to come back and get it from somewhere to do the job all over again so these cells can continue to survive as long as we live. So that unoxygenated blood, and I want you to remember this, that not all the time, but as far as the heart has veins and arteries. We all know that, but the veins carry blood into the heart, and the arteries have blood coming out of the heart and going to other different parts of the body. So with that being said, we have the unoxygenated blood. It comes in 2 ways through the heart, at the bottom and at the top. At the bottom, it comes in through what we call, and you don't have to remember this, the inferior vena cava. And it comes into the right atrium. And then it also comes in through here, the superior vena cava. You see that? It all comes through there. And that is the unoxygenated blood. Now, someone may say, well, what gas station are they stopping at to get this refuel of oxygen supplied blood? Well, the answer is, once it comes into the right atrium and ventricle, it will go up into what we call the pulmonary artery. So the blood flows up into the pulmonary artery, and that's where the blood gets oxygenated at. Now, from the pulmonary artery, you have the blood that will flow into the pulmonary veins, and the pulmonary veins dumps that oxygenated blood into the left side of the heart. Now, I know from this figure, you're seeing, looks like it's disconnected. Well, how is this blood getting into the heart? Because this don't look like it's connected to that. So if I can show you maybe a little more by dissecting the heart, I'm going to take this off, and I'm going to show you it's happening behind the scenes. You can't really see it on here, but in the 3D figure here, that blood shoots up this way, but you can't see it with this particular diagram. But it is connected where it flows. Once it flows into the arteries, then it comes back out it circulates into the left side of the heart. I will tell you, the left side of the heart is the hardest chamber than the right side. This is where all the work occurs. This is where the systolic blood pressure and the diastolic blood pressure takes place. So the blood is dumped into the left side of the heart. And then after that, that blood has to get ready to get prepared. And it's all oxygenated now because it went through the pulmonary system. And it has to come out into the circulation to feed the kidneys, the livers, all the other organs that are not associated with the heart. And the way it gets dumped out, or I shouldn't say dumped out, but comes out, is through the aorta right here. And this aorta, it's got 3 loops here, or 3 holes. it's going to take the blood in different directions of the heart. So every part of the body will get the blood flow. And you will see that on this model as well. I don't know if you can see it, but you'll see it on this model as well. There's the aorta. Now, so that's basically what the blood flow, how it travels through the heart. And so I won't repeat it again, but that's basically how it goes. Comes in through the right side, goes through the pulmonary system to get oxygenated, to get refueled, and comes out through the pulmonary veins and goes into the left ventricle. These little lines you see here, if you can see it, they bring it, zoom in, little squiggly lines. They are the valves that keeps the blood flowing in the right direction. So if you guys ever heard of the mitral valve, the tricuspid valve, the aortic valve, that's what these are here. And I'm not going to go into it too much, but they keep things flowing in the right direction. If you have a valve that is diseased, it will affect the way the blood flows. And when that happens, there are some problems that happen. There's problems that happen a lot, but one of them could be like congestive heart failure. And that's because when the blood starts backing up, and it starts backing up over here, and then it can work its way around, you will have what they call, if you ever heard people say, an enlarged heart. Sometimes you get an echocardiogram done, and on that echocardiogram done, the doctor will see that you have an enlarged heart, okay? And then that has to be worked with as well. And we won't go into any more about the echocardiogram and the ejection fraction and all that. Maybe we'll save that for another time. But what happens with the congestive heart failure, it can be due not just from diseased valves. You can have congestive heart failure from long-term hypertension, things like plaque building up, anything that's going to affect these arteries in your blood, in your heart, can cause blockage and backup. So for people that have congestive heart failure, of course, they're going to have some shortness of breath, just depending on how bad the backup is. When you see people with congestive heart failure, you see people with edema, swelling in their extremities. But you can basically get swelling anywhere, because remember, blood goes to all different parts of your body. But the swelling in the lower extremities comes from when the blood circulation is not working right, you develop what you call fluid in your veins, and then it starts to spill out into I call it the interstitial space. But it starts to build up, and so you start getting some leg swelling. When you're in the hospital and you come in for shortness of breath, and if you do have a history of congestive heart failure, this is what the doctor looks for. They look at the echo to see if you have an enlarged heart, see what your ejection fraction is. They look at your vein, your jugular veins in your neck, if that's distended. And of course, they look at your chest x-ray, and I'll explain that in just a second, to see if there's fluid buildup in the lungs. And then there was one other thing they look up. And of course, they look at the edema in your extremities. Now, on this picture, you cannot see the lungs, but the lungs are connected, sandwiched right in between the heart. So most of the times when something affects the heart, it's going to affect the lungs. So when you have congestive, I should say, I don't know if I say congested or not, but it's congestive heart failure, because you will hear some people say congested, but it's congestive, congestive. I have to watch myself. When you have congestive heart failure, that lungs will start to build up with fluid. Now you're wondering, well, how is that here? I don't see any lungs. So I'm going to try to give you a better picture of what that looks like. If you can see my picture here, those are the lungs. You see how the heart is sandwiched in between the lungs, and you see where the little pulmonary, tubes are going. They're really close to the lungs. So what happens is that fluid now starts to back up into the lungs, and that's what you call congestive heart failure. And of course, the treatment for that is things that we call them diuretics, like Lasix and things like that. But I won't go too much into that. The other thing is we're going to talk about blood pressure. The American Heart Association now says that they would like to see a blood pressure of less than 120 systolic and a diastolic of less than 80. Now, mind you, when you're up there in your age, 60s, 70s, maybe even 80s, and you've had long-standing high blood pressure over the years, you may not can quite maintain those numbers. And so what you do is I always say collaborate with your doctor. Don't go in and let your doctor just sit there and tell you this. Bring your list in. Tell them what you're expecting. That's called collaboration. And a lot of times we don't do that, but we need to go in for a list of things, and we need to have a partnership with our doctors of what our goals are. So when you go in, if you're at that point, you need to ask your doctor, even though the American Heart Association says this, at my age, and because I've had blood pressure for over 20 years, what should my numbers be? But you always need to collaborate with your doctor. Now, I do this program, Menopause Energized. I have a whole program. It's a health coaching program. And the reason why I did this, one reason why I told you was because I don't know if I said it, but I love education. I love to educate and coach. The other reason too is that there are a lot of great doctors out here, but you guys, let's be truthful. They don't have time to sit down with you another extra hour to educate you on all this stuff. So I and many others of us, nurses and mainly nurses, registered nurses, we try to do our best to put out programs to help you a little better understand what's going on with your body and when you should seek help. My program is all educational, informative. My program is not here to give you advice of what medicines you should take, diagnose you with illness. That's not the the goal in my health educational program. It's all about health education. It's a small part. Now, when I did my case management health coaching, I did that. It was really a lot to that. It was complex. I made sure patients were going to their appointments. I did do their medicines with them. I could tell them oh, this may be this, go to the emergency room. But for Menopause Energized, it's all about informative and education and coaching. So enough of that. Oh, one thing I will tell you, as far as the nutrition part with your heart, oh my gosh, that's really important. But we won't go in that too much this time. I do have if you go to my website, www.menopauseenergized.com, all the tools and resources are there. And I do have a new nutritional coaching program, and it's for 3 weeks. It's all recorded, but I am coaching you all the way through. The first week is on teaching about nutrition for diabetes, getting again into the foundation, learning about what diabetes is all about and the pancreas, and getting you into the nutritional part. Then week 2 is hypertension, and week 3 is cholesterol, how to maintain those levels. Even if you're diabetic already or have hypertension, this program is for both people that do not have these conditions yet and for ones that do. And it's all centered around for women's health in the menopausal years. Can someone else watch this and get this program as well? Absolutely. But it is centered a lot too around women's health in the menopausal years. Okay, let's talk about back to the systolic blood pressure. That's when your heart contracts, and it's all done in, again, the left side of the heart. That gives you your systolic blood pressure. When the heart relaxes in between your beats, depending on how quick your beats are, that's when you get the diastolic blood pressure. Now, for the heart, and let me backtrack a little bit. There are all different reasons why we can have a diseased heart. It could be from years of not controlling your blood pressure. It could be high cholesterol. High cholesterol will form plaque. And when it forms plaque on your arteries, instead of your arteries being like this, it's like this. Well, what do you think happens when your arteries narrow like this from the plaque or from the long-standing hypertension? The blood has a harder time getting through. That causes pressure. Another dangerous concept to this is that when you have plaque, guys, this is really important. Whether it's due from cholesterol or other things, and we won't go into that, could go into that as well, it can break off. That's dangerous because plaque can travel to parts of your body to cut off the circulation that you don't want. And that could be also to your heart. Not only that, if this is a complex thing that I won't get into now, but the blood clots come in there with it as well. Blood clots can travel to certain parts of your body as well. But there's an analogy or behind that. We won't get into that today. So just remember, those are what can cut off your circulation to certain parts of your body. So when we talk about a heart attack, some people say MI, and I'll explain that in just a second. We really need to be careful with that because, like I said, cardiovascular disease is the #1 killer in women. I have watched women come in with subtle symptoms like shortness of breath, but then once the doctor work them up, there's a reason why. They look at other things, of course, that especially your family history, but that's big time. If you got a family history of heart disease, the doctor looks into that. But when the doctor finds other reasons to go further, instead of sending you home and saying, oh, it's just your asthma or it's seasonal allergies, there's sometimes they'll pick up reasons to look into it further. And sometimes when they look into that reason, they decide, this warrants a cardiac catheterization, which of course is the tube they put up in your groin into your heart to see if there's any blockage. They will sometimes, for some women, find that they do have a blockage. So yes, like I said, shortness of breath is nothing to play around with if you have that consistently. So always pay attention to all the symptoms, but women, shortness of breath can come with it. And I don't know if I said this. In our body, women, we have more of, for some reason, in the females, research has shown that when the blood supply gets cut off a little bit, it attacks like more of our small vessels than the vessels that are in the men. And so because those vessels are smaller, you get more subtle symptoms sometimes, not all the time, because you can have the full-blown symptoms of heart attack, chest pain, or it don't even have to be chest pain. It could be a feeling of indigestion. Let's see, what else? Nausea, vomiting, sweating, radiating down your arm, radiating up in your neck, radiating up in your jaw. All those symptoms you need to pay attention to. But this is the reason why sometimes, as I said, women get the subtle symptoms because of those small, it's attacking the small microvessels. So you hear of something called MI. That's a myocardial infarction. Now, why do you think that they call that a myocardial infarction? That's because it attacks the myocardial tissue muscle of the heart. Okay, now you can't really see it here. You might want to say this is it, but this is not a real good diagram. So I'm going to take my model here and show you what that's like and what happens with an MI. When your heart muscle, it doesn't happen directly in here, it happens in the myocardial muscle of your heart, which is, if you can see it, it's all this brown looking stuff here. And if you see this red, white, and blue, those are your coronary arteries. So when you're not getting enough rich oxygen blood, whatever the reason could be, buildup of plaque over years, a blood clot that has traveled, it's cutting off your circulation to the myocardium tissue. And when that happens, that's what possibly you could have a heart attack. So it's the myocardial tissue that's being affected. And the coronary arteries is supplying the myocardial tissue. So that's why coronary arteries are so important, because when they do a cardiac cath, that's what the doctors are checking for. They're checking to see if you have any blockage, not in the myocardial muscle of the heart. They're checking to see if you have any blockage in the coronary arteries, because that's where the blood has to pass through to get to the myocardium tissue to perfuse that. And if there's a blockage in the coronary arteries, then that muscle tissue, the myocardium, is not going to get that rich oxygen blood. And when it don't, it dies. Now, and I hope you see that. I'm going to bring that a little closer for you to see that. See the red and blue? Those are your coronary arteries. So when they do the cardiac cath or cardiac catheterization, they want to see if those arteries are blocked. If they are, sometimes it's just medicine management or medical management, if you want to say that. Sometimes they have to open that artery up and put a stent in. So you will hear people say, hey, I had a cardiac cath and I had a stent placed in. And that's why, to keep those arteries open and for the blood flows. But this is the important topic that I want to let you know about. So should I do it here? If you are having symptoms of a heart attack and you are not sure, you should always call 911 and seek help. Because if you do not call 911 and seek help in time, the longer you wait, the more damage to the myocardial tissue, or some people say the muscle, myocardial muscle. But this is the thing that's even a little bit worse than that. That tissue can't be replenished. The longer you wait, if you think you're having symptoms, don't call a doctor the next day. Don't try to drive your car. You call 911 and get that hospital and get there very quickly. That's why a lot of times they'll take you, if they think something's going on, they'll rush you to the cardiac catheterization lab right away. The longer you wait, the longer that tissue is not getting the oxygen it needs, it will be damaged, and more, it could spread to more damage across the tissue the longer you wait. And the third thing is that that tissue cannot be replenished. Once it's damaged, it's damaged. And for the rest of your life, you are definitely going to have to change your lifestyle to move forward. So that's what I wanted to tell you about the MI. So I believe I covered everything today. I believe I covered everything. So basically, I just want to give you a little bit of information about the heart so that now as we move forward through the next 29 days, you will keep this in mind and you will remember some of the things we talked about. So when things come up, you'll say, so that's why that worked that way. Like today, we talked about why is it called the MI? It's called the myocardial infarction because it affects the myocardial tissue. I think all this is important before we go further and talk about anything else and give you tips and strategies. I can never pronounce that word. I'm sorry. I even got a couple of words I'm dyslexic on, but that's another story. But anyway, so I wanted to bring this information to you. Tomorrow, day 2, I hope you can join me as well. Always look for these sessions in the evening time because I know, or if you're looking for it and you don't see it in the morning, that's probably because it's going to be done during the evening time because I know people work. But then again, too, these are recorded, so it will be recorded. I'm live now, but it will be recorded because I'm saying, what am I saying? It is being recorded now, but I'm live. Does that make sense? Anyway, you can watch it at any time. Now, tomorrow, again, I will not be taking up an hour and a half of your time for 30 days. I will just be giving tips about 5 or 10 minutes. We are going to discuss about estrogen. I try to put it in order to figure out which one flows to the next, to the next, to the next. You get my drift, right? Okay, so tomorrow we're going to be talking about estrogen and how it's so important. You guys, please attend this one as well, or when you can, because it's going to be on YouTube. Estrogen, when you lose that, it affects the heart. That's why the risk is higher of heart disease in the menopausal years. So I'm done for the day. I hope you guys, I don't like to teach or educate on this stuff. Now, can you go on, of course, people say Google and find out this information? Yes, some of it you can, but some of it may be a surprise. But it's not about that. It's about actually listening to someone explain this to where you can understand it, where you're just not sitting there reading something. You absorb it better, to me, and you're more motivated to actually make a change and do something about that. So if you like this day 1 of the Healthy Heart Marathon, please like, please comment, please share, and please subscribe to my channel because this is my program along with going to the website to find whatever resources we have. But this is my my program, and so I will always be on YouTube pretty much all the time giving tips. Now, of course, after the 30-day marathon, I won't be on there every day, but I'll be on there quite frequently because this, like I said, this is my passion, and we women are going through this alone, and we shouldn't be. So the other thing I want to tell you as well, I am also the author of Beyond the Footprints of Menopause. And so it is a powerful book, ladies. It takes you to, I decided to be personal. My personal story takes you through my personal journey and my challenges that I had and how I got through that journey, coming out better actually on the other side than when I was in my younger years, believe it or not. Menopause taught me so much about myself. And I have the guides and the tools in there that you can get through it as well. And you can wind up also being better. Then you don't want to try to go back to what you used to be. You want to go coming back and being fresh and new and regenerated. It's almost like your cells get regenerated. And I talk about in my book about writing your next chapter. When you finish reading my last chapter, that's not the end. The next one is going to be writing your new chapter. So get that book, guys. It's powerful. It is on Amazon. And the link is there below, but just go to Amazon and look up Menopause Energized, and it is there. Again, subscribe, because I'm going to always bring stuff forward. Women, we do not have to go through menopause alone. There are programs like mine that is out there for support. So until I see you the next time, take care.